Hey, Cindy, good morning.
Good morning.
Good to see you.
You.
Overall, better, improving?
Oh my God, yes.
Where are we at? I think we were at 80% improvement from last time you came in, I think.
Yeah, it's probably about staying a little better. I'm able to sleep at night, which is a big deal.
That was a big deal.
Yeah, and the noise is way less. And
Noise is way less?
Yeah, and here's the other thing I discovered yesterday that changed is if I'm lying down or I'm sitting still, my ears are ringing. If I am up walking around, it's gone.
So obviously positional.
Yep.
Okay. Well, this is good news though overall compared to when you came in. So, yeah. Hey guys, I'm Dr. David Warwick of Warwick Chiropractic and Massage in Lacey, Washington, and we have Chris who came in with tinnitus, diagnosed with tinnitus, and you did other providers. You had the MRI. Did you have a CAT scan too?
Yes.
ENT, all these things evolving around the tinnitus. And I wouldn't say that she had marked improvement on visit 1, but there was around visit 2 or 3 is when you started to notice the improvement. Wouldn't it be true? Was
Yes.
that true or not? Okay.
Yes.
And today now, our last visit, we've had at least, I think this is a 6th session if I'm not mistaken. And not uncommon for people, and everyone varies a little bit, but all of a sudden, as you heard, probably over 80, maybe 90% improvement from where she was at. And it was so bad with the tinnitus, but it was stemming from the neck area, the cervical spine, where there was compression around the atlas axis, upper area of the spinal cord, and affecting the cranial nerves as well. And so we started working with that, didn't we?
Yeah.
Adjusting that. As you'll see today, we use some cold laser therapy as well to help assist with the inflammation and pain that she was feeling, but way different today, guys. So definite improvement. And nothing brought this on in particular, as I remember, correct?
That's correct. I woke up with it in one ear and 2 days later had it in the other.
A lot of anxiety and stress around that, isn't there?
Oh, yeah.
Okay, let's have you turn your head to the left for me. So we're checking the atlas. I saw a change in the leg length. Bring the head back to the middle. Okay, and we're going to do some pressure testing. When I tested the atlas, now I'm using an instrument called the torque release instrument, or called the integrator from torque release technique. Very specific adjustment, upper atlas bone affecting the atlas that can misalign in 21 different directions. So I'm using it more right, from right to left, and there's a torquing motion that helps improve it's actually a counterclockwise direction of correction in there. Really light. Take a deep breath in. Relax it. I should probably show you this. Here's the instrument. There's many different tools that chiropractors utilize, but this is one that I like to get really specific with. More of a tonal based type of style of adjusting. We use hands. We've done that with you, right, Chris?
Yeah.
So an improvement. When I'm doing this test, I'm still seeing some misalignment in the lower back. All right, take a deep breath in, Cindy. Release it out. Adjust in the sacrum. Table will drop. Good. All right, turn your head left. Turn it right. And back to the middle. Tuck your chin down, hold it there, slowly turn your head right, slowly turn your head left, and back to the middle, untuck the chin. So we're checking C2, very important. Another upper cervical area, and I'm adjusting from behind, posterior to anterior with clockwise correction. I'm using the instrument. And when people have things that are involved, you get really specific in your style of adjusting. Some doctors use their hands, some use instrumentation, but all these different techniques help and work for people. So big improvement through there. All right. Stretch. And good. And let's have you lay on your back. Has this been your first experience at a chiropractic office, correct? Or second?
No, it's
been a while.
It's been about
Long.
10 years.
Been a while. So we're using a support right in the middle of the chest. This helps so we can adjust the middle back. Some chiropractors use this technique. Big breath. And out. So some of Cindy's background sits at a desk. You drive a desk?
Yes.
Yeah. People that sit at a desk, a lot of hunching over at the computer. So a lot of her mid-back, there's a lot of kyphosis where the spine goes like that. And so when we start adjusting, that changes the posture. Okay. All right, checking motion in the neck. So we're just down at C2, C3. What we noticed that we had to start adjusting Cindy left side first. Good. Breathe.
Oh my.
That was an oh my moment. I get
Oh,
those
good.
too when I see my chiropractor. And what a difference though in how your neck feels. There we go. Big breath. Release it out. Lift your head and down. And traction. Good?
Good, very good.
All right. Let's have you sit facing this way. We're going to change up a little bit. So one of the things that your posture nice, so when you do sit in the chair, make sure you're safe in the chair, but start coming to the front 50% of the chair. That'll cause you to sit up more, sit upright more using the core of your body. Core from here to down to here. Muscles will get stronger. When you get tired, then sit back into the chair. Okay? But you're entering retirement soon, so you don't have to worry about that.
1 week.
Yep. And you were worried that you wouldn't have good retirement. I think you're going to have a much better retirement. And plus you're going to start taking care of yourself and getting out, exercising more.
Yeah.
Another thing I do with my vertigo or tinnitus patients, I will adjust the ear as well. This brings blood flow to the inner, middle ear. Good. Good. All right. How's that feel?
Good.
Better?
Yes.
A little bit different than what you typically see. Anything you want to share with someone that's suffering with tinnitus? Tinnitus, as it's sometimes called, vertigo, and what your experience has been coming with this office.
Chiropractic has really saved me from the ringing in my ears. It was extremely debilitating when I came in here for the first visit.
I remember that.
By the second or third visit, I was noticing a difference. And now I still have a little bit of ringing, but the volume is just turned way down, and I can tell it's going away. It's getting much better. So I would encourage anyone with
To give it a try.
to give it a try and see if it will help, because it's definitely helped me.
And everybody responds differently with various treatments and that. So, but a little shaky at the beginning because people aren't used to that big of a change. So we had to individually work with the patient. Yes, some people respond quickly, some take a little bit longer. We're all unique and different. So
Yeah, thank you.
you did awesome.
Thank you.
I'm Dr. David Warwick of Warwick Chiropractic Massage. Thank you for watching.